Hello, my friends. Dr. Saif Kazmi here, and today we are going to talk about an approach to altered mental status. A very challenging concept. I'll try to simplify it is in very simple words. So we'll start with a sort of in a clinical example, just to make it more interesting for you. So I will give you the hypothetical scenario that a 14 years old girl is brought to the emergency department. She's brought by the paramedics with a complaint of being unwell and drowsy all day long. So she is a healthy girl who for the whole day has been quite drowsy, has been feeling unwell, and she's been lying in her bed. So the further details in the history says that she was fine till last night, but and she slept well. But since she woke up this morning, she's been feeling unwell. She's been lying all day in her bed and is not much responding to social cues. There is no history of fever. She hasn't got any fever. She hasn't got any cough. She hasn't got any difficulty in breathing. She hasn't got any other physical complaint. As far as past medical history is concerned, it's insignificant. She is generally in good health. She's currently on no medications and she has got no allergies. She's fully immunized. So when you examine her, all her vitals are stable. So she's got normal blood pressure, heart rate is fine, cap refill time is fine, respiratory rate and sats are fine, and everything is within the normal limits. Now the question is, how would you approach this child? So remember, in these type of cases, we are dealing with a child who is drowsy, who is unwell, who is not responding to social cues. So by definition, that becomes an altered mental status. An altered mental status can have so many different reasons. So we have to go in a stepwise manner. Again, irrespective of the different like 100 types of things that can cause altered mental status, we always start with the basics. So remember ABCDE. So remember, the first thing you have to do is check the airways. They are open. You have to see that the child is breathing fine. She hasn't got like any difficulty in breathing, hasn't got any recess. The sats are fine. If they are not fine, you have to give them oxygen. Then you also look at the blood pressure and other things, that the child is not in shock. And after that, you check the blood glucose levels. Remember, hypoglycemia, because of different reasons, somebody's not eating or somebody has taken something which might take blood sugar down, or there's been like starvation, or it can happen because of other reasons as well. That is something that can be very quickly addressed. So you always check for hypoglycemia at the bedside. You also check at the oxygen saturation levels, because for some reasons, if the oxygen saturation levels are low, that can cause drowsiness, altered mental status, and that can be quickly addressed by giving them 100% oxygen. You also look at the carbon dioxide levels. Again, you can do it by the simple blood gas, because the carbon dioxide levels are rising in the body because of any reason, respiratory acidosis, or any other problem. Then again, it can be addressed by blowing of carbon dioxide. Again, an ECG or the heart rate would give you an idea if the heart rate is very fast or very low. That can also give you an altered mental state. So this quick sort of a screening for certain things which can be very quickly fixed would rule out these things, and at the same time you won't be missing these important things which can be very easily fixed. Now after that, a child who's got like an altered mental state is basically a neurological problem. So you would do a quick neurological examination. So quick neurological examination means that you have to check for the GCS, the Glasgow Coma Scale, to see where the child is like uh, lying on that GCS, or in very small ones you can do the AVPU scale as well, whether the child is alert, whether he is responding to vocal or painful stimuli, is completely unresponsive. You also look at the pupils. You record the pupil size and its reactivity to light, whether it's like dilated, whether they are normal, whether they are brisk to light, whether they are sluggish, or whether they are unresponsive to light, so on and so forth. So you look at the power and tone. You can quickly look at the cranial nerves, and if needed, if the child seems to be confused, you can do a quick mini mental state examination as well. So if you find some form of focal deficit, like you feel like one side is weak or has got high tone or low tone, then the best thing would be to start with a CT head. That's the first thing, because obviously if there's something wrong in the brain, you need to find it out. So CT could actually rule out so many things, which can be the reason of altered mental status. Because if there is an intracranial bleed or intracranial tumor or something, that can be picked up on the CT head. If the neurological examination is fine, then you have to look for certain other reasons. So the type of reasons which can be responsible for altered mental status are so many. There are metabolic reasons, there are infectious reasons, there are toxicological reasons, there are psychological reasons which can cause altered mental status. So let's go through them quickly. So the first one is metabolic causes. So metabolic causes means that somehow the metabolism is such that it's not able to produce proper raw materials which are needed by the brain to properly function, or the waste products in the body cannot be thrown off. So the buildup of the waste or toxic materials is causing an altered mental status. So how do we check this? So we will check at the electrolytes. So UNE, thyroid function tests, liver function tests, that would give you an idea. Looking at the serum magnesium, serum calcium, blood urea nitrogen, remember that they can give you an idea whether there's any metabolic reason for altered mental status or not. So you will take the blood for UNE, electrolytes, LFTs, TFTs, renal function tests. Similarly, some of the infectious causes. So if the infectious causes are there, usually in most of the cases the child might be having fever, but let's say if they've taken some medication like paracetamol, so at that point in time they may not have any fever. But some of the infections like the central nervous system infections, meningitis, encephalitis, can cause altered mental status. Some generalized like infections, generalized viral infections, or sepsis because of any bacteria can also give you an can give you an altered mental status. If the infection is spreading and the child is unwell. Similarly, some of the toxicological causes like alcohol. So if somebody is intoxicated or somebody has taken overdose of the opioids or benzodiazepine, that can give you altered mental status. And sometimes, rarely, if everything else is normal, psychological causes can also give you an altered mental status. So that could be a catatonia. It's a state like a dissociative state where the child feels paralyzed or is not responding to the social cues, though everything is normal and all the neurological examination normal. We call it catatonia. So catatonia could be one reason, or sometimes this could happen in severe depression because the child is depressed, so they are not interested in their surrounding other things. So just lying, and it feels like they've got an altered mental status. Sometimes in schizophrenia, when they have got like psychosis and they are sort of broken from the reality, then they can be very much agitated, like they can have delirium, and they would be having an altered mental status. So these are some of the causes that can cause altered mental state. Now, how do we approach these children? So I have made this diagram and it would make your life very easy. So again, a child who has come with an altered mental status, so you always start with the ABC. So you will start with the airways. So always open and maintain the airways. So see if the child is uh, breathing properly or not. If you feel like they're having like snoring or something, you can slightly like do the head tilt and chin lift, and that would open up and maintain the airways. At the same time, you also ensure that the breathing is there. So you would be looking at the oxygen saturation, you'll be looking at the respiratory rate, and if you needed, you can put the child on oxygen, so you can give them 100% oxygen. You also look at the C, so you will be looking at the heart rate, blood pressure, capillary fill time, and the color of the child. So obviously, if there is problem with the circulation, heart rate, the child has got tachycardia, capillary fill time is greater than 2 seconds, the blood pressure is down, or the color is a bit off, then obviously you are dealing with shocks. In that case, a fluid bolus is warranted. Similarly, you look at the pupil side, that would be part of your quick neurological examination as well. So you look at you could do a quick GCS or the AVPU scale, and you also check the blood glucose level, because that is something which you can quickly fix by giving them hypertonic 10% or 25% dextrose. In E, you look for any rash on the body to see if there is anything like meningococcemia. You also check at the temperature to see if there is any infectious reason which might be responsible for the altered mental status. Now, while you are doing your ABCDE, by this time you have passed an IV line and you do a quick CAP gas. So CAP gas would tell you if the child is acidotic or alkalotic. It would give you an idea of the not only the acid-base status, but it can give you the initial sodium and potassium levels as well. Like it can give you if they tell you if there is any electrolyte imbalance or not. Then you can also take bloods for proper, like you can take bloods for full blood count. You need to do urea and electrolyte, CRP, LFTs. You have to do the magnesium, calcium, and bone profile, alkaline phosphatase, and all those, albumin, thyroid function tests. You need to do the QAG profile as well. And sometimes, if needed, if the child is tachycardic or the blood pressure is down, through the same line, you can give some IV fluid. If you think that there might be some sepsis, you can give antibiotics. You can give dextrose if needed, or if you think that the child has got some toxidrome or has taken something, you can give antidote like naloxone and things like that. At the same time, you do an ECG to rule out the tachycardia or tachybradyarrhythmias, and then after that you do a thorough examination, and if you find any abnormality, you would be dealing with that accordingly. If there's a history of seizures, agitation, or head trauma, or there is some neurological deficit, you have to do an immediate CT of the head. If needed, like if everything is fine and you think, usually if the child is adolescent or they've got a history of self-harm or they have been out, you have to do a urine toxicology screen as well, because some of the drugs can cause too much excitation or neurological depression and can lead to altered mental status. If you still haven't got any clues, then you can consider rare etiologies like Wilson disease or neuropsychiatric systemic lupus erythematosus or porphyrias. These are quite rare conditions, but once in a while they can present with altered mental status. Usually they present with neuropsychiatric symptoms without any reason, but obviously common things come first, so you have to rule out the other reasons before you put someone to be, having suspicion of Wilson disease or neuropsychiatric SLE or porphyrias, because they would require special tests, and obviously you have to make sure that you have ruled the common causes of altered mental status. So this is all about altered mental status in a very short, simple lecture about practical approach to altered mental status. If you have liked this video, uh, give me a like or thumbs up. And if you haven't subscribed to my channel, do subscribe. And if you got any question, put it down in the comment section below, and I'll be more than happy to answer that. Have a good day. I'm signing off. Bye bye.